Okay, so today I'm going to talk about DHEA again. This is 100 milligrams per capsule. I got it really cheap actually. Um, a while back I was using it just because I thought, some sort of hormone therapy after 45, 50 years old. I was feeling really sluggish. I had like a lot of brain fog. I think it's really difficult to find out what um, the causes of your symptoms are. Symptoms are one thing, but then finding out the cause is another. So after doing research on oxalates and um, uric acid, which I'm pretty sure I had both like high levels of, um, I started looking into how to reduce it. And there was something about arthritis and DHEA, and I was reading, and so I tried it at like 25 milligrams and then like 50 milligrams because I'm kind of careful about this stuff, especially hormones. Um, and there was like nothing noticeable. But after a while, I decided, well, because some people were doing it in upwards of 100. Like I was reading how like the safety level is pretty high without. I mean, I'm not going to say without any consequences or withdrawal when you stop, but probably very little. So basically, what I read is that you could try it with very few consequences. Um, so two things that I noticed happened, and I don't know if this is coincidence because it could have been I was drinking a lot of dairy, which also evidently reduces uric acid levels. So dairies, cherries, and DHA helps with arthritis, right? So at the same time, just by coincidence, I was drinking like a lot of dairy, and my back started feeling better, like my rib cage and my back started feeling better, and that's where one of the problems is. I can't sit for too long without any pain. Uh, it feels like someone's trying to extract your ribs out of your back. That's kind of what it feels like. It's like the blood eagle, right? Anyway, so I tried this at like 100 milligrams, and I started kind of feeling good. And I was like, I don't know if that was the dairy or that was the DHEA. So I decided like to skip the dairy and just up the DHEA. And basically, like I'm taking like 200 milligrams in the morning, which is pretty high because what they say like the average is like 50 milligrams or something. And it is very absorbable. I mean, you can find blood levels high, so at least it's in your blood. And I started feeling like better. So I could sit for longer without having that pain. And it's really hard to do work if you can't sit. Um, Basically, that's kind of my update for DHEA. I think if you guys want to try it, start with like 50 or 25 and then work up from there. If you buy them in like 25 milligram increments, you can up it and lower it as you want. I bought this one 100 because I knew that it was going to be okay. I was already up to 100 before I bought this bottle, so I just bought the um, cheaper one, I guess you could say, because once it gets to a higher level, they start getting cheaper by the milligram. So that's about it. So this is an update video. I know a lot of my videos repeat, but I think that's really important because you can't just try something once, make an announcement, and expect nothing to change. Uh, it's a, in that case, you would already know everything about it, and I don't think we do. So anyway, I'm going to stop here, and I'll talk to you guys next time. Bye bye.